Welcome, everyone. So let's look at the self-care model by Dorothea Oriem. So in this presentation, we'll look at this self-care model and see what are the elements and concepts that actually make it up. And then we explain these key elements or concepts. Including things like self-care deficit, the nursing systems, and what they actually mean in relation to this model. So remember, we are basically looking at the different nursing theories that can be used in caring for patients. We looked at the Nightingale theory. Now we are looking at the self-care model by Dorothea Oriem. So this theory focuses on an individual's ability to perform self-care activities. When we talk about self-care activities, we include activities like nutrition, feeding yourself, making sure that you maintain personal hygiene, okay, exercising, all the things that keep you healthy and maintain your well-being. Those are the ones we call the self-care activities. Okay, so a healthy person can be able to carry out these activities without need for assistance or help. So they don't depend on other individuals for help. The moment they get a health condition and then they cannot do these activities on their own, they cannot eat on their own, they cannot sit on their own, they cannot brush on their own, then we say that they have what we call self-care deficit. Okay, the needs that they have exceed those, exceed their self-care capabilities. They can't do them on their own. And now what we call the nursing systems in this theory is a framework that describes how nurses provide care to individuals with self-care deficit based on the level of dependence and complexity. We shall look at this later on. You have those patients who are relying on nurses or on others for most of the activities. And then we have those that can rely on others for some of the activities. So if it is some of the activities, what do the nurses do? If it is all the activities, what do the nurses do? So that kind of framework is what you call, that kind of framework that allows us to provide care depending on the level of self-care deficit that the patient is having, is what we call the nursing systems. So at the core of this model is that nurses help others to take care of themselves, okay? So if a patient can't comb their hair, the nurses can help in that and other things like. So the role of the nurse, therefore, is to assist the sick, or those that have self-care deficits in maintaining self-care. Okay. It cannot also apply only to the sick, but also those who appear well. They can also either be educated to make sure they can really take care of themselves. The ultimate goal is that we want people to take care of themselves, okay? So they don't have to rely on others for these activities. So the aim of nursing care, therefore, is to attain the highest achievable level of patient dependence. the patient should be able to do some of these activities. And that is what we keep on encouraging the nurse, the patient to do. If they can't walk and they are recovering, we encourage them to start practicing how to walk, so that they are independent and they don't need assistance to walk. So we look at 3 partial theories within this self-care model. One, which is self-care, which we said that these are activities that everyone should be able to perform independently without any need for assistance. And this is rooted in the fact that every human being is capable of self-care. Okay, so the key elements here is that we want to make sure that the patients can be able to carry out this self-care. And then another aspect is what you call the self-care agency. So the power or the potential to engage in self-care. If someone is sick, they may not lose their ability to take care of themselves, though they are sick. Okay, but you also have those who are sick and they cannot really do, they cannot take care of themselves. They cannot do what you call self-care. So the power or the potential to engage in self-care activities is what you call agency. And then we have the third one, which is self-care requisites. Okay, what has to be done to make sure that the individual's self-care needs are met? Okay, so what actions do you have to take? That's also an element that we are going to look at. So the actions relate to what deviation has happened. If there is a deviation from the normal physiological parameters, okay, or from the deviation in health, that means that we will need to provide care in the appropriate time-bound care for normal physiological function and health. So we can say that these requisites fall under 4 categories: universal requisites, developmental requisite, therapeutic requisites, and then health deviation, self-care requisites. When we talk about universal self-care requisites, these apply to all human beings. All human beings need to eat, they need to breathe, they need water, they need to eliminate. That is, they can pass urine and feces in a normal way. That is elimination. And then they can engage in physical activity. They can have enough sleep, enough rest, solitude. They can interact with others, and they don't get exposed to hazards, and also promotional. They can engage in promotion of normalcy. Okay, so these are things that everyone really needs to be able to do, okay, in order to be healthy. And then we move to the developmental self-care requisites. This relates to the fact that individuals have different needs across their lifespan, because they go through different stages of growth and development, and therefore developmental changes do happen, and these can influence their health, their self-care abilities, and other social or personal goals. Okay, so in this, the role of the nurse is to make sure that they provide care that is appropriate with the developmental or growth stage that the client is in. Sometimes you'll have clients who have delayed developmental milestones. So what type of care that do you have to provide to people who have delayed developmental milestones? Okay. And then you have what you call the health deviation self-care requisites. Okay. This is when now the person is actually sick. Okay. The person is sick. There's a deviation from the normal. Okay. So what has to be done is, of course, seeking medical attention, making sure that they comply with the treatment, and then also they need to understand themselves, the concept of self-concept, and then adjustment of lifestyle, and then learning to live with the effects of the illness or disability. Okay, so these are things that the nurse will be participating in. And then we move to therapeutic self-care demand. This basically is the total amount of all the total amount of self-care actions that are required to meet the needs of the individual at any given time. Okay, so the key things here is that the nurses deal with the effects of self-care. Okay, they manage self-care and be able to make the client more and more independent. So how do they reach that level of independence? Of course, you need to identify what the patient really needs, the deficits that they have, and then provide the care that they need. The care can be by acting for the patient. Okay, if it is helping them take a bath, if it is feeding them, it is whatever it is, taking medication. It can involve guiding the patient on what to do. It can be supporting the patient, can be providing the growth oriented environment, and then also teaching. These actions differ in accordance to the level of the self-care deficit. So the theory underlines the importance of self-care for sustaining health, okay, life and also recovery. So it underlines that, or it emphasizes that these elements of self-care are very, very important, okay, and therefore if patients can't be able to care for themselves, that is when they have self-care deficits, then we can use the framework to be able to care for them. However, it has its own limitation. One is that it is a little bit more complex because it uses terminology like self-care urgency and deficit, which can be complex to understand. It also looks at health as a static phenomenon, yet we actually know that health is dynamic in nature. It keeps on changing. And then it does not look at the emotional aspects of care. And then also it basically doesn't focus on issues to do with the social aspects and the emotional aspects of health. So it is basically limited in that way. Thank you for listening. We have come to the end of this theory. Thank you.